Malaria, tuberculosis, cholera, HIV, AIDS, name the disease, you have it here. Here in the heart of the other India, here in the country's poorest state, Chhattisgarh. These are bleak faces around me, faces with hardly any dreams worth dreaming about. But there is one glimmer of hope. 7 years ago, 8 doctors, almost all of them from AIIMS, decided to give everything up and come here, looking not for glamour, not for money, but for chance to serve the people who need to be served. The 4 couples are spreading sunshine here in the jungles, not far from where Naxalites challenge the rule of the law. And though it's just the dawn of a new day, and the shadows still linger on these faces in the queue, rural Bilaspur gratefully acknowledges the presence of these doctors who are slowly changing their lives.
बिल्कुल भरोसा है साहब, इतना यहाँ अच्छे तरीके से माने इलाज किया जाता है कि हम खुश हैं।
It happened more than 10 years ago. Some doctors in AIIMS, the best medical institution in the country, wanted to do something more with their lives. They wanted to step out from a big city, move to the countryside, serve the rural poor.
रोटी खाना है, सब कुछ खा सकते हैं.
Idealism was more important than getting rich. It took a long time to set this hospital up in Ganyari, 20 kilometers from Bilaspur town, and 7 years later, the results are really showing.
जो ये हॉस्पिटल है, हम तो उसको मंदिर मानते हैं.
Meet Dr. Yogesh Jain, the inspiration of the team. Dr. Anurag Bhargav, the Mr. Energy of the group. Dr. Raman Kataria, the quiet surgeon. And Dr. Biswarup Chatterjee, the polite microbiologist. They had an intellectual support system in Delhi, doctors, scientists and the rare bureaucrats who believed in their dreams and helped them pursue it. Some of these doctors went to big school, DPS R.K. Puram and modern school Barakhamba. 3 of them are national scholars, and all 4 just came together.
I think Yogesh asked me, I remembered the exact place, even I think it was in 94. He asked me if I'd like to do this kind of work, and I just told him yes without even consulting my wife.
What acted as an even greater catalyst was that all 4 married doctors, Dr. Madhvi Bhargav, Dr. Madhuri Chatterjee, Dr. Rachna Jain and Dr. Anju Kataria. Some of them even met in AIIMS.
We were working in the same hospital, All India Institute of Medical Sciences. But all of us were together, there were 8 of us, and that made things easier.
Every couple takes home a total salary of rupees 25,000. They don't want more because then it causes too much disparity with other members of the staff. Is that enough family income in the 21st century?
I don't think I miss driving around in a Mercedes.
I mean, if it's more, then we just wouldn't be able to run the organization. I mean, we are taking 12, which is a big chunk. I mean, most of our other staff members take much less.
In Ganyari, you get the feeling that it's the women who are sometimes doing more than their husbands. They do surgeries, they man the OPDs, they run the 13-bed ward, and they even attend clinics in the remote villages. These women are more than equal participants, and they have their views on the money their husbands and they themselves take home.
There are financial constraints. I won't say that they are not there. Sometimes one regrets also, but it's okay. But one feels more satisfied after doing. At the end of the day, you are happy.
I think one needs more if you increase your own needs, and you never know where you can get satisfaction.
So they keep their food simple. Take a look at this canteen, where doctors, patients, friends, other members of the staff all come together. And it's about self-service. Self-sufficiency and personal hygiene are both basic requirements here. So after an ordinary but nutritious lunch, what you need to do is wash your own plate. And they have their children, whom they don't want to deprive, and they are sent to Jain International, the best school in the outskirts of Bilaspur. There are the birthday parties, like this one for Biswarup's daughter, where they come together and talk everything but work. Some do have support system, like Dr. Rachna Jain's mother, who is also a doctor. She has taken up a job at the Bilaspur hospital and lives in the neighborhood to stay close to her granddaughters. She's quite honest that her son-in-law doesn't earn enough.
Well, it's not my decision. It's their decision. And before marriage, if I knew so much, I would have taken a decision. Otherwise, now it's their decision.
Dr. Biswaroop and Madhuri Chatterjee have other worries. Their son has a medical problem for which they need money. The treatment is seriously expensive. He has to take up temporary jobs elsewhere to keep the money coming in.
Well, I don't think I'm switching between jobs, but yes, I definitely need more money for my son. Although all my friends have been very supportive. But even then, as a father, I feel obliged that, okay, whatever I can earn myself, it's better, done that way.
8 people who are together living out a dream they had dreamt ages ago. What about ego conflicts? There are bound to be differences.
There are moments of ego conflicts. It's always there are problems, but the main goal is the same, and the motive of coming together is we bear that in mind and we are continuing.
And so every Monday, Wednesday and Friday mornings, Ganiyari hums with activity. The queues are long. Swasthya Sahyog has taken over healthcare in Bilaspur. The primary healthcare centre is desolate. Even the doctors and other staff are seldom present. 8 doctors have turned things upside down in this tribal and scheduled caste dominated very backward district.
I don't think anybody can do so much as they are doing. You would rather describe them mad? In normal parlance, I being a normal human being, I will call them mad.
These doctors are definitely not the firsts of their kind. Others like this equally popular bearded doctor travelled this path before. Dr. Binayak Sen had given up everything after graduating from Christian Medical College, Vellore, and had dedicated the early part of his medical career to the health of miners. He has been an inspiration for these doctors as well.
Yes, in many ways, because there is a group of doctors in Bilaspur, as you know, who wanted to, they were also socially motivated and they wanted to work together as a group.
Fortunately, Ganiyari and Bilaspur are slightly cut off from the spreading Naxalite map of the country. These doctors can avoid tough decisions, which Dr. Sen couldn't. A remarkable change has been made possible in the past 7 years. A big community of trained women is keeping a close watch on the health of their neighbours. Ambulances are bringing in emergency cases to the Ganiyari hospital, where doctors receive and treat patients with unquestionable dedication. But beneath these positives is a set of questions which the doctors have begun asking. Why is the social system so unjust, so unequal? When we come back, we'll try to understand how these doctors want the imbalances in the public healthcare system to be corrected.